Well, Dr. Alison Avenell is one of the co-authors of the report and joins me now from Aberdeen. First of all, Dr. Avenell, can you briefly explain exactly what your study has found?
Yes, our study was part of a collection of data from many trials which have taken place around the world, looking at calcium supplementation and whether calcium prevented fractures. What we went and did in connection with these trials was collected the data to look and see if there were any adverse effects from taking calcium supplements. There'd been some suggestion in the past that perhaps calcium might influence cardiac disease. And when we put all the data together from 12,000 people, we found that there was about a 30% increased risk for people taking calcium of getting a heart attack.
So that was, I'm sorry to interrupt, so just to clarify that was the risk of getting a heart attack increased, but not of death.
I'm sorry, you're very faint, I can't hear what you're saying.
No, I was just saying that the risk of heart attack has increased, but not of death.
Yes, the risk of death wasn't statistically increased. There was a slight increase of death, which may be something that's just due to variation in the sample that we looked at. Overall, there didn't appear to be an increased risk of death in this particular study.
Just one final point. Of course, there are other ways of getting calcium rather than just through tablets, aren't there?
Yes, that's right. It's much better if people take calcium in their diet rather than through supplements. And there isn't any evidence that taking plenty of calcium in the diet has an effect on cardiac disease at all.
Dr. Avenell, thank you very much indeed.
These vitamins, vitamin E, vitamin C and beta-carotene, sometimes called antioxidant vitamins, were thought to be protective by making cholesterol less toxic to the blood vessels and perhaps also reducing the risks of cancer. But over a 5-year period, in this population, we found no evidence whatsoever of any benefit.
But industry experts claim the vitamins studied do have a positive effect on health.
There's study after study that shows people who get higher intakes of the antioxidant, the protective vitamins and minerals, they get less heart disease, they get less strokes, they get less high blood pressure, they get less arthritis even.
The researchers say the best source of vitamins and minerals is fruit and vegetables. Nutritionists agree, and their advice: spend money on improving your diet, not on vitamin supplements.
The view of a lot of health professionals is that perhaps vitamin supplements do have their place, but first and foremost people should look at their diet and look to improving their diet before they go out and spend money on vitamin supplements.
Though the
Fix a Broken Heart by Colin Collins. Triglyceride deposit cardiomyovasculopathy is a heart and blood vessel condition where plaque builds up in the arteries due to high levels of triglycerides in the blood. This buildup can lead to symptoms such as chest pain and difficulty breathing, and can increase the risk of heart attack or stroke. Osaka University researchers discover that taking Tricaprin regularly in your diet leads to a reduction in coronary artery plaque and an improvement of symptoms for patients with triglyceride deposit cardiomyovasculopathy. As children, our parents encouraged us to take vitamins for growth and strength. Now, Japanese researchers have found that a specific supplement may even repair a broken heart. In a study that was recently published in the European Heart Journal, researchers from Osaka University discovered that a dietary supplement can significantly improve heart disease symptoms in a subset of patients. Coronary artery disease, CAD, which involves narrowing or even closing of the arteries of the heart and often leads to heart attack, is a major cause of death worldwide. Despite the existence of treatments such as cholesterol-lowering drugs and drug-eluting stents, a new stent technology for local drug delivery, death from this condition is still common, and some patients appear to be resistant to treatment. TGCV is an emerging cardiovascular disorder characterized by diffuse narrowing coronary atherosclerosis with triglyceride (TG) deposition caused by defective intracellular lipolysis. TGCV is an often undiagnosed condition in patients who are resistant to standard therapies. Panels A and B concern 2 patients in their 60s with refractory angina pectoris and diabetes mellitus. After being diagnosed with TGCV, they started dietary intake of Tricaprin. Their symptoms improved within a couple of months. Follow-up coronary computed tomography angiography showed marked regression of atherosclerotic lesions with luminal dilatation. Left coronary artery shown as red line in upper panel A. Right and left coronary arteries in upper panel B. The low attenuation area observed from the adventitial side, yellow and orange area, in the middle, panel A, and its volume, yellow bars in the middle, panel B, were reduced, indicating ameliorated lipid involvement. These observations were associated with increased myocardial lipolysis on iodine 123 beta-methyl p-iodophenylpentadecanoic acid scintigraphy, lower panels. Credit. 2022, Kenichi Hirano. Remarkable regression of diffuse coronary atherosclerosis in patients with triglyceride deposit cardiomyovasculopathy, European Heart Journal. Almost 15 years ago we identified a new type of CAD called triglyceride deposit cardiomyovasculopathy, TGCV, in which the coronary arteries are occluded by triglyceride deposits generated by defective intracellular breakdown of triglycerides in vascular smooth muscle cells, says lead author of the study Kenichi Hirano. This mechanism makes TGCV distinct from classic cholesterol-induced atherosclerosis, and accounts for patients who are resistant to standard remedies for CAD. The researchers had developed diagnostic criteria for TGCV, and showed that this condition is especially prevalent in patients with diabetes mellitus and those who have undergone hemodialysis. Despite the ability to diagnose this condition, however, an effective treatment for these patients remained elusive. Now we report a remarkable regression of diffuse coronary atherosclerosis in 2 patients with TGCV, states Kenichi Hirano. Both had suffered from refractory chest pain and diabetes until diagnosis with TGCV, and subsequent dietary intake of Tricaprin led to symptom relief. Coronary CT images with a color-coded display for Case 1, Panel A. Color-coded short-axis CT images before, and after, on treatment, B, Tricaprin treatment. The short-axis images of the left coronary anterior descending artery are shown at every 0.2 mm. A, B, C, D, E, and F correspond to cross-sectional images of the second image. Credit. 2022, Kenichi Hirano. Remarkable regression of diffuse coronary atherosclerosis in patients with triglyceride deposit cardiomyovasculopathy, European Heart Journal. Tricaprin is a commercially available food supplement that promotes lipid breakdown by heart muscle cells. In addition to relieving these patients' troublesome and painful symptoms, Tricaprin also resulted in remarkable regression of the triglyceride buildup in the blood vessels of the heart. While atherosclerosis regression following decreased serum lipid levels is well described, this is the first report of regression due to increased triglyceride lipolysis within cells, and as such is a conceptually novel treatment for coronary atherosclerosis, says Kenichi Hirano. Given that not all patients respond to current treatments for CAD, the findings from this study pave the way toward establishing a multifaceted approach to CAD treatment. The dramatic results achieved by administering a readily available dietary supplement hold promise for patients who would otherwise continue to suffer the debilitating effects of this disease. Reference. Remarkable regression of diffuse coronary atherosclerosis.